Welcome back to Nursing Stories, where vitals are stable but the plot isn't. Nursing students, in 3 minutes, you'll learn how to connect vital signs to your patient's CMP results, which medications to give or hold based off their CMP results, how to identify critical labs, and nursing interventions to implement for those critical labs within the CMP. So, let's paint the scene. Miss Betty Sue has heart failure and takes furosemide daily. She tells Nurse Jean she can feel her heart beating through her chest, and it sometimes feels like her heart is running from her. Nurse Jean assesses Miss Betty Sue first by checking her vital signs. Miss Betty Sue's heart rate is a little tacky, but everything else is within normal limits. Nurse Jean looks at her most recent lab work to identify any other potential causes of her tachycardia. Nurse Jean knows her CMP can give insight into Miss Betty Sue's electrolyte levels as well as her kidney and liver function. Miss Betty Sue's CMP results come back. Nurse Jean knows furosemide is commonly used in patients with heart failure, and it is the strongest diuretic in pulling off fluid, which should lead to your patients losing a lot of potassium and sodium as compared to other diuretics. And patients with abnormal potassium levels, whether high or low, can experience heart dysrhythmias. Nurse Jean knows that when potassium is out of range, it can cause heart issues. So she remembers all of the causes of high and low potassium, just to make sure there isn't any other reason that could cause Miss Betty Sue's potassium level to be low. So she covers herself and confirms her low potassium is more likely coming from her taking furosemide. She knows because Miss Betty Sue is complaining feeling like her heart is racing and her potassium level is low, the provider will most likely place her on telemetry and start her on a potassium replacement protocol. Miss Betty Sue complains of her feet being swollen and painful, so she asks for ibuprofen. Before Nurse Jean says yes to an NSAID like ibuprofen, she checks her kidney function. Since Miss Betty Sue's GFR was low and her creatinine was elevated, Nurse Jean knows that NSAIDs should be avoided in patients with kidney disease because it can worsen their kidney function, and it increases their sodium and water retention in patients with heart failure. So, Nurse Jean tells Miss Betty Sue she can't give her ibuprofen because of her kidney function, but she can give her Tylenol because her liver function is good. If your patients have heart failure and is on furosemide, you want to monitor the potassium and sodium levels. If your patient has a low potassium level, you can anticipate them being placed on telemetry and on the potassium replacement protocol per orders. If your patient is complaining of pain, you want to check their GFR and their creatinine before administering NSAIDs. And if they have decreased kidney function, but their liver function is good, you can administer Tylenol. See you guys next week.